Here is my CAPS265 articulation worksheet. For the program and institutional outcomes, course names, and brief description of the course portfolio projects, including a summary of how the outcome was met. Demonstrating an understanding of patient, client, customer service needs within the continuum of health and human services. The course outcome that was met was the MDAA 208 Quality Improvement in Customer Services in Medical Offices. The outcome was met by examining verbal and nonverbal communication and the impact on customer service expectations and evaluating customer service scenarios and recommending solutions to improve the customer service experiences. Demonstrate ethical and legal communication techniques specific to the health and human services environments is the CAPS 265. Information literacy and communication utilize appropriate current technology and resources to locate and evaluate information needed to accomplish a goal and then communicate findings in visual, written, and or formal formats. Using current technology from clinical, financial, and operational systems to support decision-making processes. Medical office procedures 2. Demonstrating proficiency to collect and enter patient data using electronic health record applications while maintaining privacy and confidentiality, and synthesizing the importance of professional communication in a medical office setting. Function as a team member to support the goals and objectives of an integrated healthcare system would be the healthcare terminology, analyzing the impact customer service has on the reimbursement to healthcare providers, and to maintain a professional communication within the workplace and or setting and patients. Analyze and apply contemporary knowledge and skill sets to perform diverse administrative responsibilities in health and human services environments would be the ethics in human and health and human services. Describing the ethical theories and philosophical approaches follow for assessing moral and or ethical decisions in typical healthcare scenarios, applying analytical techniques to resolve ethical dilemmas presented in healthcare studios. Utilize appropriate current technology and resources to locate and evaluate information needed to accomplish a goal and then communicate findings in visual, written, and or oral formats. And that will be the medical office procedures 1. Evaluate business practices of the medical office setting and the impact on efficiency and customer service expectation. Utilizing appropriate current technology and resources to locate and evaluate information needed to accomplish a goal and then communicate findings in visual, written, and oral formats. Transferring knowledge, skills, and behaviors acquired through formal and informal learning and life experiences to new situations will be the course Philosophy 222, Ethics in Health and Human Services. Transferring knowledge, skills, and behaviors acquired through formal and informal learning and experiences to new situations. Participating in social, academic, and professional communities for individual growth and to function as a citizen of a multicultural world. Employ strategies for reflection on learning and practice to adjust learning processes for continual improvement. Would be the HCA S123 healthcare terminology. Employ strategies for reflection on learning and practice in order to adjust learning processes for continual improvement. Follow established method of inquiry and mathematical reasoning to form conclusions and make decisions would be HCAS 123, healthcare terminology. Follow established methods of inquiry and mathematical reasoning to form conclusions and making decisions. Participate in social, academic, and professional communities for individual growth and to function as a citizen of a multicultural world would be the philosophy 222, ethics in health and human services. Which will be the institutional outcomes, quantitative and scientific reasoning.